Welcome to Thermography Medical Clinic's webinar series. Today, I'm going to be talking about breast implant illness. Have you ever heard of breast implant illness? Are your breast implants making you sick? Find out how thermography may be the guiding light that brings awareness to possible health problems related to breast implants. While thermography does not diagnose breast implant illness, it plays a critical role in helping to guide the patient and practitioner to determine if breast implants could be the underlying cause of unresolved health issues. My name is Sharon, and I am a registered homeopath, a holistic nutritionist, and a medical thermographer. I am the founder and clinic director of Thermography Medical Clinic since 2010. I am an interpreter for Thermography Medical Clinic. I was the clinic founder and director of Divine Living, which was a natural health clinic from 2005 to 2022. My philosophy is a personalized, proactive, and preventative approach to healthcare. What is breast implant illness? And is it an actual medical condition? How is it diagnosed? And how is it treated? How can thermography help you know how your body is responding to the implants? And how does inflammation affect your health? We will take a look at a case study that shows the role of thermography as a health assessment tool. What are breast implants? Breast implants are considered a medical device. This medical device is surgically implanted to increase breast size or replace tissue that has been removed. The body treats the implants as a foreign object and tends to coat the device with a capsule made largely of collagen. This is an attempt at the body trying to protect itself from the foreign object. Did you know that implants contain chemicals and heavy metals? Most people aren't even aware of the chemicals that are in the implant. And as a result, when the implants are placed in the body, so are the chemicals. It's not just the chemicals that leach out of the implants that can cause issues. It's also the body's reaction to the presence of the implants. Everyone that has implants will have a reaction to them. First, the body creates tissue to encapsulate the breast implant to isolate the foreign material. This is a protection mechanism. The physical mechanical friction of the implant in the capsule causes inflammation, which is ultimately the immune system's healing response. Collection of microorganisms and cellular material called biofilms may form at the surface of the implant, causing further inflammation. That's just disgusting. The body's immune system may become confused by the presence of a persistent foreign object, which is the implant, and begin to attack itself, creating an immune response. So what is breast implant illness? And is it an actual medical condition? How is it diagnosed? And how is it treated? Breast implant illness refers to a range of symptoms that appear after getting breast implants. Breast implant illness isn't recognized as an official diagnosis. So for women who suffer from a variety of chronic symptoms post-implant surgery, the illness is real enough for them to seek out various medical treatments in the hopes of reducing their symptoms. Many women complain of having an overall feeling of being unwell, and symptoms may vary, making it difficult to connect the dots and come up with a diagnosis of breast implant illness. These are some of the symptoms associated with breast implant illness. These symptoms may occur immediately after the implant surgery, or in some cases they develop over time, making it harder to connect the symptoms with the implant. Symptoms such as fatigue and low energy, cognitive dysfunction. Many women report brain fog or memory loss, headaches, joint and muscle pain, and even hair loss, recurring infections, swollen lymph nodes and swollen glands. Many women report random rashes, IBS, which is irritable bowel syndrome, or problems with thyroid and adrenal function. All of these symptoms have been associated with breast implants. So is there a diagnostic criteria for breast implants? How do I know if I have it? Sadly, there's no specific test to diagnose breast implant illness. The only way that women come to the conclusion that they have breast implant illness is by putting the timeline together on when the symptoms started or when pre-existing symptoms may have gotten worse. These new or worsening symptoms always occur around the time of the placement of the implants. So what's the treatment? We know that treating the symptom doesn't work, so what has to be done? The only way to treat breast implant illness is to begin by removing the implants. After that, it can still take time for the body to heal. The body's stress response to the implants may take time to settle down, and the inflammation caused by toxins from the implants also need to be addressed. So how are your implants affecting your health? Let's take a look at your health with thermography. First of all, how can thermography help you? Thermography gives you a picture of your body and shows you where it's asking for help. Thermography is the only test that allows you to visualize what is going on and where the problem's areas are. Thermography can also help to monitor your health journey by showing you if the changes you are making are improving how your body is functioning. So what does thermography do? Thermography generates a thermal map of the body, showing areas that are too hot or too cold or present with abnormal patterns. By analyzing these skin temperature changes, it can be determined how your body is responding to the implants. Where is the inflammation and what organ systems are stressed because of the implants? The role of the thermal map. Skin temperature changes or patterns identify inflammation in the body or congestion. And by this, I mean, is your body sluggish and holding on to toxins? Thermal maps also show circulatory changes, inflammation caused by dental problems, lymph congestion, whether there are toxins in the body, adrenal stress, and even injury or imbalances related to the musculoskeletal system. Let's take a look. The first image shows dental inflammation on the left side. The second image shows disc inflammation and corresponding soft tissue inflammation caused by injury in the lower back. The third image, which is of the abdomen, shows a pattern that indicates kidney and adrenal stress. The fourth image of the abdomen shows inflammation caused by toxins, pathogens in the body. And that fifth image shows inflammation caused by lymph congestion and adrenal stress. The sixth image, the last one, shows congestion, poor circulation in the breast caused by breast implants. These are just some examples of what thermography can show us. Inflammation. How does chronic inflammation affect your health? There is now a broad consensus that long-term inflammation contributes to the onset of many chronic conditions. Let's take a look at how inflammation sets your health up for failure. So inflammation is the body's natural response to injury or illness, or even stress, and it is a normal part of a healthy immune response and the healing process. However, inflammation can become chronic if the underlying cause is not addressed. Chronic inflammation keeps the immune system on overdrive, and the resulting long-term unresolved stress on the body drains the capacity of the immune system to deal with other stressors. While it's important to address inflammation, it's critical to resolve the underlying cause of the inflammation to give your immune system a chance to heal. So how are your breast implants affecting your health? Let's see how thermography can help. Thermography isn't a diagnostic tool, so thermography won't show you specifically if you have breast implant illness. There's no specific patterns that indicate breast implant illness, but the good news is that having a full body thermography study will show you how your body is responding to the implants. Is there inflammation? And where is the inflammation? Is my body stressed? And what organ systems need help? Health is a journey, and breast implants may be a bump in the road that can significantly affect your health. Health is a journey, and each person has their own unique health journey, and as a result, each person presents with their own unique thermal signature that tells the story of where their body is asking for help. Help may be needed because the implants are wreaking havoc on the nervous system, leaving a person in a constant state of fight or flight. Most people have heard the term fight or flight, but a lot of people don't realize the damage this causes to a person's health. Fight or flight causes an overactive nervous system, which leads to chronic inflammation. Chronic inflammation eventually compromises the immune system, and when the immune system is compromised, the disease process sets in. So to address inflammation, you must identify and address the underlying cause. I explain the underlying cause in the context of a sliver. So let's talk about the sliver. I like to use the sliver example because most people can relate to this because they've had a sliver in their finger at some point in their life. It's amazing how much pain and inflammation one tiny sliver can cause. If you have a sliver in your finger and all you do is put a Band-Aid on your finger, it's never going to heal. You have to remove the sliver to get the finger to stop being inflamed, so the healing process can begin. Implants could be the sliver. Breast implants are foreign objects, which for some people create a constant state of fight or flight, as the body tries to figure out what to do with these foreign objects. Let's go through a case study. Breast implant illness is more common than most people think. Unfortunately, many practitioners miss this piece of the puzzle and patients never get better. Many women develop chronic health issues either immediately after having breast implant surgery or some years down the road. So we know that breast implants cause problems. In terms of patient care, many practitioners fail to recognize breast implant illness. It's likely the patient doesn't even make the connection to the implants themselves. Women with breast implant illness develop their symptoms after implant surgery. For those who already had underlying conditions, it's likely that their health status declined further after the implant surgery. These patients have typically tried everything from dietary modifications, supplementation, detoxification, medications, manual therapy treatments, or exercise regimes with no success. And that is because they aren't addressing the underlying cause. So let's take a look at the following case study. If a patient is responding to treatment protocols that are geared to addressing endocrine disruption, reducing inflammation, and promoting detoxification, then it's time to look for the source of the problem. So this patient had a history of colds, headaches, sinus infections, and bladder infections for over 10 years. She reported constant digestive issues. She tried many natural treatments, including various supplements, IV therapy, lymph drainage, and dietary modifications. She had to rely on antibiotics frequently for recurring sinus and bladder infections, and this is what her thermography study showed us. This set of images gives you a picture of what is going on with this patient's health. You can see in the first image the vertical pattern in the forehead, which indicates inflammation caused by kidney and adrenal stress. There's inflammation over the sinuses, and the nose is unusually warm, which is known to correlate to cardiovascular stress. The lateral right image shows inflammation caused by lymph congestion. There is some inflammation along the right carotid artery, which is also an indication of cardiovascular stress. The heart can become stressed when the nervous system is overactive and when there is chronic inflammation. The anterior breast image shows branching patterns that indicate inflammation caused by lymph congestion. And in the lateral images, there's heat in the armpit regions, which is also an indication of inflammation caused by lymph congestion. In the abdomen, those scattered hot spots indicate inflammation caused by bacterial imbalance or toxins in the body. And the trunk image shows those hot hands, which also indicates cardiovascular stress caused by an overactive nervous system. The patterns in her study indicate inflammation caused by adrenal stress, that overactive nervous system that we've talked about, kidney stress, and toxins and pathogens in the body. The underlying cause of the inflammation is most likely caused to her breast implants. Given that her symptoms started shortly after the implant surgery, and based on the findings in her thermography study, she knew that the solution was to have her implants removed in order to give her body a chance to heal. So she did, and this is what happened. These are her follow-up images, and I will show you the comparison shortly. After she had her implants removed, she reported feeling immediately better after having the explant surgery, like a weight was lifted off of her body. She has not had a sinus infection since the implants were removed, and she indicates a significant improvement in her digestion. She's still not completely resolved, but she says things are so much better. She has no more headaches and no more bladder infections. So let's take a look at the before and the after. Hopefully, you can visually see the changes in the images. The before and after images clearly show a significant reduction in inflammation. It can be concluded that removing the implants made a noticeable difference in this patient's symptoms and in her level of inflammation. Thermography is a valuable assessment tool for visualizing a person's state of health. In the context of breast implant illness, while thermography does not diagnose breast implant illness, it plays a critical role in identifying how the body is responding to the implants. The role of thermography. In this case, it identified inflammation and organ system stress. Hopefully, it makes the practitioner ask questions to help guide the patient in the decision-making process on their health journey. Thermography monitors the progress of the treatment plan. Are your breast implants making you sick? Find out how your body is responding by having a thermography study done. Are you concerned about your health? To learn more about how thermography can help you, the following videos are available on our website, thermography.medicalclinic.com, and our YouTube channel. For more information, you can visit our website, thermography.medicalclinic.com, and follow us on Facebook and Instagram.